Hello students and friends. Welcome to Homeopathy Medicines Dulcamara. Today in this homeopathic materia medica lesson, I will discuss about homeopathic medicine. Before start this video, please subscribe to this channel for learn homeopathy online free and homeopathy materia medica digitalis purpurea. We need support from you to make this channel more beautiful. Now going to discuss about Dulcamara digitalis purpurea, its uses and symptoms. Comes into play in all diseases where the heart is primarily involved, where the pulse is weak, irregular, intermittent, abnormally slow, and dropsy of external and internal parts. Weakness and dilatation of the myocardium. Its greatest indication is in failure of compensation and especially when auricular fibrillation has set in. Slow pulse in recumbent posture, but irregular and dicritic on sitting up. Auricular flutter and fibrillation especially when subsequent to rheumatic fever. Heart block, very slow pulse. Other symptoms of organic heart disease, such as great weakness and sinking of strength, faintness, coldness of skin, and irregular respiration, cardiac irritability and ocular troubles after tobacco, jaundice from induration and hypertrophy of the liver, frequently call for digitalis. Jaundice with heart disease. Faint, as if dying. Bluish appearance of face. Cardiac muscular failure when asystole is present. Stimulates the heart's muscles, increases force of systole, increases length. Prostration from slight exertion. Collapse. Mind, despondency, fearful, anxious about the future. Dullness of sense. Every shock strikes an epigastrium. Melancholia, dull lethargic with slow pulse. Head, vertigo, when walking and on rising, in cardiac and hepatic affections. Sharp, shooting frontal pain, extending into nose, after drinking cold water or eating ice cream. Heaviness of head, with sensation as if it would fall backward. Face bluish. Confusion, fullness and noise in head. Cracking sounds during a nap. Blue tongue and lips. Eyes, blueness of eyelids. Dark bodies, like flies, before eyes. Change in acuteness of perception of shades of green. Objects, appear green and yellow. Mydriasis, lid margins red, swollen, agglutinated in morning. Detachment of retina. Dim vision, irregular pupils, diplopia. Stomach, sweet taste with constant ptylism. Excessive nausea, not relieved by vomiting. Faintness, great weakness in stomach. Burning in stomach extending to esophagus. After cold water or ice cream, sharp pain in forehead, extending to nose. Faintness and vomiting from motion. Discomfort, even after a small quantity of food, or from mere sight or smell. Tenderness of epigastrium. Copious salivation. Neuralgic pain in stomach, unconnected with taking food. Abdomen, pain in left side apparently in descending colon and under false ribs. Severe abdominal pains, pulsation in abdominal aorta, and epigastric constriction. Enlarged, sore, painful liver. Stool, white, chalk-like, ashy, pasty stools. Diarrhea during jaundice. Urine, continued urging, in drops, dark, hot, burning, with sharp cutting or throbbing pain at neck of bladder, as if a straw was being thrust back and forth, worse at night. Suppressed. Ammoniacal, and turbid. Urethritis, thymosis, strangury. Full feeling after urination. Constriction and burning, as if urethra was too small. Brick dust settlement. Female, labor-like pains in abdomen and back before menses. Uterine hemorrhage. Male, nightly emission, digitalin, with great weakness of genitals after coitus. Hydrocele, scrotum enlarged like a bladder. Gonorrhea, balanitis, murk, with edema of prepuce. Dropsical swelling of genitals, self. Enlarged prostate. Respiratory, desire to take a deep breath. Breathing irregular, difficult, deep sighing. Cough, with raw, sore feeling in chest. Expectoration Swedish. Senile pneumonia. Great weakness in chest. Dyspnea, constant desire to breathe deeply, lungs feel compressed. chronic bronchitis, passive congestion of the lungs, giving bloody sputum due to failing myocardium. Cannot bear to talk. Hemoptysis with weak heart. Heart, the least movement causes violent palpitation, and sensation as if it would cease beating, if he moves. Opposite, gels. Frequent stitches in heart. Irregular heart especially of mitral disease. Very slow pulse. Intermits, weak. Cyanosis. Inequality of pulse, it varies. Sudden sensation as if heart stood still. Pulse weak, and quickened by least movement. Pericarditis, copious serous exudation. Dilated heart, tired, irregular, with slow and feeble pulse. Hypertrophy with dilatation. Cardiac failure following fevers. Cardiac dropsy. Extremities, swelling of the feet. Fingers go to sleep easily. Coldness of hands and feet. Rheumatic pain in joints. Shining, white swelling of joints. Muscular debility. Nocturnal swelling of fingers. Sensation in legs as if a red-hot wire suddenly darted through them. Dudgeon. Sleep, starts from sleep in alarm that he is falling from a height. Continuous sleepiness. Fever, sudden flushes of heat, followed by great nervous weakness. Skin, erythema, deep red, worse on back, like measles. Blue distended veins on lids, ears, lips and tongue. Dropsical. Itching and jaundiced. Modalities, worse, when sitting erect, after meals and music. Better, when stomach is empty, in open air. This drug as used by the old school has done more mischief than any one drug in their Materia medica. Every patient who had a fast heart, or anything the matter with the heart, was given digitalis. It has caused more deaths than any drug. If administered when the heart is going fast it will soon produce a peculiar kind of paralysis, the heart then having lost its balance wheel, compensation gives out, the patient sinks and finally dies. They do not know that many patients would have lived through fevers, pneumonia and other acute diseases if it had not been for this medicine, used as they have used it, in the tincture, in many drop doses, until the heart was slowed down. They call it sedative. Yes, it is a sedative. It makes the patient very sedate. You have seen how very sedate a patient looks after he has been in the hands of an undertaker and has on his best garments. That is what digitalis does. In that way it is a sedative in the hands of the allopath. A homeopathic physician never prescribes to bring down the pulse. He prescribes for the patient and the heart's action takes care of itself. Digitalis is a very poor fever medicine. Instead of being indicated when the pulse is fast, the proving says it is indicated when the pulse is slow. The allopath gives it when the pulse is fast to make it slow. If given to a well person it will make the pulse slow, and when indicated in a sick person the pulse is slow. It produces a great disturbance of the liver. Congestion and enlargement of the liver. Soreness of the liver. Tenderness about the liver but during that time the pulse is slow. It makes the bowels very sluggish, produces inactivity of the liver, and stools are bilious, light-colored, putty-like and the pulse is slow. Add to that jaundice and you have a grand picture of digitalis. Jaundice, with slow pulse, with uneasiness in the liver, pale stool, and even if you have never seen or heard of digitalis before you will scarcely miss it. Now, you might add a myriad of little symptoms, but it does not change the aspect of things. It is digitalis. Another group of symptoms that belongs with the digitalis heart, the digitalis liver and the digitalis bowels, is a gone, sinking feeling in the stomach. It seems as if he would die, and he does not get better from eating. It is a nervous, deathly sinking that comes with many heart troubles. You would not be surprised to find in digitalis much nervous prostration. Restlessness and great nervous weakness. Feels as if he would fly wide to pieces. Anxiety. Feels that something is going to happen. Seems as if his whole economy were full of anxious feelings and restlessness. Lassitude, faintness, exhaustion and extreme prostration. Faints on the slightest provocation. It begins in the stomach, an awful sensation of weakness in the stomach and bowels. His sleep is full of horrible dreams, nightmare, fright. Dreams of falling that is very common with cardiac affections. When the pulse is too slow, when it is irregular, the brain is irregularly supplied with blood during sleep, and there is a turbulent state. A shoe goes through the body like an electric shock, like internal jerkings, twitchings. Sudden muscular movements, as if a current of electric passed through the body. This, with slow pulse, with a sense of faintness, and great weakness. Bluish paleness of the lips in persons who suffer at times with cardiac spells. It seems at times as if the pulse would cease. Face becomes blue, the fingers become blue. Wants to lie on the back. Frequently startled in sleep, jerking at night. The heart symptoms are numerous, but none is so important as the slow pulse. The pulse is slow in the beginning of the case. It may now be flying like lightning. He is anxious, restless, has horrible dreams and sinking in the stomach. That sounds like the advanced stage of digitalis, but I want to know if in the beginning, the pulse was slow. The patient himself seldom knows, but someone says that in the beginning the pulse was 48, that is digitalis. If the pulse in the beginning was rapid, do not think of digitalis, for it will not do any good. The digitalis pulse is at first slow and perhaps remains so for many days, until finally the heart commences to go with a quiver, with an irregular beat, intermits, feels as if it would cease to beat, and then we have all these strange manifestations. Weakness is the very character of the digitalis pulse, and all these characteristics go along with it. First it is slow, and sometimes strong. Slow, strong pulse when rheumatism is threatening the heart. Violent, but not very rapid pulse. Sudden violent beating of the heart, with disturbed rhythm. The slightest motion increases anxiety and palpitation. When the pulse is going very slow, sometimes down to 40, the patient turns the head and the pulse flutters and increases in its action. If he turns over in bed, it seems as if the heart would stop. If he moves, he feels it fluttering all over him, and it settles back and is slow again, but, finally, it changes and flutters all the time. Palpitation of the heart originating in grief. Sudden sensation as though the heart stood still. Fluttering of the heart. The least muscular exertion renders the heart's action labored and intermittent in a feeble heart. A person with an enlarged liver, with a slow pulse, with jaundice and pale stool. With that he will have a troublesome cough. Digitalis is not much of a remedy for a cough unless it is a cardiac cough. Cough at midnight. Cough, with expectoration of boiled starch. Cough, with expectoration of bloody mucus in hypostatic congestion of the lungs. Cough, brought on by talking, walking, drinking anything cold, bending the body. These are coughs associated with other troubles. The same thing is to be said of the respiration. There are difficulties of respiration, along with cardiac troubles and liver troubles. Respiration irregular and performed with great difficulty. Constant desire to take a deep breath. When he goes to sleep, the breath seems to fade away, then he wakes up with a gasp. Lachesis, phosphorus, carboveg. And some other remedies have that, remedies that affect the cerebellum particularly, producing a congestion of the cerebellum. When a patient goes to sleep, the cerebrum says to the cerebellum, "Now you carry on this breathing a little while, I am getting tired." But the cerebellum is not equal to the occasion. It is congested, and just as soon as the cerebrum begins to rest, the cerebellum goes to sleep, too, and lets the patient suffer, and in that way we get suffocation. The cerebellum presides over respiration during sleep, and the cerebrum presides over respiration when the patient is awake. We might learn that from the provings of medicines if we never found it before. Fear of suffocation at night. Now, to analyze that. He knows from experience that every time he drops into a sleep he suffocates, and hence he fears to go to sleep for fear he will suffocate. The fear of suffocation at night is from this origin. It is the same if he falls asleep in the daytime. Can only breathe in gasps. Digitalis is a useful medicine when there is a filling up of the lower part of the lungs. The patient is sitting up in bed, and there is dullness in the lower part of each lung and plenty of resonance in the upper portion. Then it is, if he lies down, he will suffocate. Digitalis likes mostly to lie flat on the back with no pillow, when there is no filling up of the lungs. But when there is hypostatic congestion he suffocates. If early in the case the pulse was slow and it has become fast, digitalis may be of some benefit. Now, a feature in connection with the genitourinary organs. In old cases of enlarged prostate glands I do not know what I would do without digitalis. Where there is a constant teasing to pass urine. In many instances where the catheter has been used for months or years because he is unable to pass urine in a natural way, and where there is a residuary urine in old bachelors and old men, digitalis is a good remedy. It diminishes the size of the prostate gland and has many times cured dropsy with suppression of urine. In uremic poisoning and in various phases of Bright's disease of the kidneys we have symptoms indicating digitalis. Retention of urine, dribbling of urine. Spermaturia. Nightly emission. In persons addicted for years to secret vices. Enlarged prostate gland. It is capable of curing chronic gonorrhea. It has cured acute gonorrhea. It has cured inflammation of that thin, delicate membrane covering the gland's penis. Dropsical swelling of the genitals. Loss of appetite and violent thirst. Most doctors give sulfur when the patient drinks much and eats little. The nausea of digitalis is not like that of ipecac and bryonia. It is a singular nausea. The smell of food excites a deathly nausea, a sinking, a goneness, associated with cardiac troubles, with jaundice and liver troubles. The nausea is accompanied by a deathly feeling, as if he is sinking away. Sometimes the nausea is relieved by eating, but the sinking remains after eating, showing that it is something besides hunger. Persistent nausea. Extreme sensitiveness in the pit of the stomach. Faintness and sinking in the pit of the stomach as if he would die. No appetite, but great thirst. Soreness and hardness in the region of the liver. Sensitiveness to pressure in the region of the liver. Now remember the liver and the heart symptoms, the jaundice, the slow pulse, the awful sinking in the stomach, the enlargement of the prostate gland, the gray stool, and you have the principal symptoms of digitalis. After all that I have said, you are not surprised at the horrible anxiety that the digitalis patient carries with him all the time. He wants to be alone, sadness, melancholy, despondency and restlessness. He can't decide upon anything that he ought to do, tremulousness. The stomach, bowel and liver troubles are just what you see sometimes in a hard drinker after trying to break off. He is prostrated, his heart gives out, is irregular, weak, slow, and he has sadness and melancholy, inability to apply himself. Digitalis will help him straighten out. Dulcamara bittersweet. This medicine seems especially to affect the mucous membranes. It appears to have a tendency to establish or ultimate discharges, both acute and chronic. The Dulcamara patient is disturbed by every change in the weather, from warm to cold, from dry to moist, and from suddenly cooling the body while perspiring. He is ameliorated in dry, even weather. Cold and damp aggravate all the conditions. He is worse evening and night and during rest. Dulcamara produces catarrh of the stomach, intestines, nose, eyes, ears, and inflammatory conditions of the skin with eruptions. If you go through any of these in detail, you will be astonished to find how disturbed is the constitutional state of this patient by weather changes. It is a medicine wonderfully useful in diarrhea, at the close of the summer, hot days and cold nights, with changeable stool, diarrhea of infants. There seems to be no digestion, yellow, slimy stool, yellow-green stool, with undigested stool, frequent stool, blood in the stool and quite a mass of slime, showing a marked catarrhal state. This gets better and worse. This gets better under ordinary remedies. It will often get better from pulsatilla, because pulsatilla symptoms seem to predominate, and sometimes it is relieved by arnica, but every time the child takes cold, it comes back again, and soon the physician will realize that he has not struck the remedy belonging to all the symptoms. It is very often an annoying condition, because the symptoms are not recognized until 2 or 3 attacks have come. It is not easy to discover that the attacks come on from cold. Every year women bring their babies back from the mountains, at the end of the season, and then we get some Dulcamara cases. One needs to be in the mountains at the close of the summer season to know what the condition is. If you go into the mountains at such a time, either in the north or west, you will notice that the sun's rays beat down during the day with great force, but along towards sunset if you walk out a draft of cold air comes down that will chill you to the bone. This will make the baby sick. It is too warm to take the child out in the middle of the day, and so he is taken out in his carriage in the evening. He has been overheated in the house during the day, and then catches this draft in the evening. Dulcamara is suitable for conditions that would arise from just such a state. So with an adult who has been out in the heat of the sun and catches the cold draft by night, which means hot days and cold nights, such as occur in the fall of the year, at the close of the summer and coming in of the winter, this intermingling of hot air and cold drafts. You go up towards the foot of the hills after a hot day, you will walk through a stratum of air that will make you perspire, and the next minute a cold air that will make you want your overcoat on, and then again a stratum of hot air, and so on. Such a state will bring out a sweat and then suppress it. The symptoms that come from Dulcamara seem to be like symptoms that arise from just such causes. And we are free, then, to infer from such an experience that Dulcamara cures these cases. I have been puzzled in times past over these babies that have been brought home from the mountains, and have prescribed upon the visible symptoms, until I thought about the matter carefully and figured it out that they had come from these hot and cold regions. Babies have to be hurried home at times, because of the diarrheas that cannot be cured in the mountains, but a dose of Dulcamara will enable them to stay there and live right in that same climate. Chronic recurrent dysentery from cold. If they have a dose of Dulcamara, it fortifies them against the continual taking of cold. There are people in a certain kind of business that really constitute a Dulcamara state. Suppose we look at our ice cream men and our ice handlers and cold storage men. In a cold room they are handling ice, the summer weather is hot, they must go out and take some of the heat, and then they go back into their cold rooms and handle the ice. I have seen these things and have had occasion to follow them out. These men are subject at times to bowel troubles, and other catarrhal affections, but generally to diarrheic affections. Their business cannot stop because it is their means of living. Dulcamara cures such chronic diarrheas when the symptoms agree. Arsenicum is a medicine that would be suitable for such patients if the symptoms agreed, but the symptoms at times agree with Dulcamara. For that is the nature of the remedy, to take cold from cold, damp places, from suppressing a sweat, from going out of a hot atmosphere into an ice house, into icy rooms, into cold rooms. In this climate such complaints as come on from overexertion, overheating, and then throwing off the clothing and becoming chilled, suppressing the sweat, fevers may come on, aching in the bones, trembling with the aching, trembling in the muscles. And as the fever goes on, he is in a distressed state, cannot remember, forgets what he was about to speak of, forgets the word that would naturally express his idea, and he enters into a dazed state, a state of confusion. It suits these colds that have this sluggish circulation of the brain, with trembling and chilliness, coldness as if in the bones. Dulcamara is full of rheumatism, full of rheumatic pains and aches, sore and bruised all over. The joints are inflamed, become red, sensitive to touch and are swollen. It is suitable in cases of inflammatory rheumatism, due to suppressed perspiration, induced by changing from a high to low temperature, or from cold, wet weather. Worse evening and night and during rest. Now, it has many chronic complaints. A catarrhal condition of the eyes, purulent discharges, thick, yellow discharges, granular lids. Eyes become red every time he takes cold, every time he takes cold it settles in the eyes, is a common expression of the patient. The patient will often ask the question, "Why is it, doctor, that every time I take cold it settles in my eyes? If I get into a cold atmosphere, or take off my coat after being heated, I have to look out. If it becomes cold in the night and he has thrown the clothes off, he takes cold, or, if a cold rain comes on, he takes cold and then has sore eyes. Such eyes are very often effectually cured by Dulcamara. As to the eye itself, it is only an ordinary catarrhal state, but the manner in which it comes on is the important thing. That is the nature of the patient to have sore eyes whenever he takes cold. It belongs to some other remedies as well, but this one particularly. Dulcamara has also catarrhal discharges from the nose, with bloody crusts, blowing out thick, yellow mucus all the time. In infants and children who have sniffles, they are always worse in cold, damp weather. When the patient says, "Doctor, in cold, damp weather I cannot breathe through my nose stuffs up," or, "I must sleep with my mouth open." Dulcamara is a very useful remedy to know in catarrhal cases that always stuff up when there is a cold rain. It is markedly an autumnal remedy. The Dulcamara patients go through the summer very comfortably, their catarrhal conditions to a great extent pass away, the warm days and warm nights, because of the even temperature, seem to agree with them, but as soon as the cold nights come on and the cold rains come, all their difficulties return. There is an increase of the rheumatism and of the catarrhal discharges. This medicine has been used a long time by our mothers. They used to make ointments out of Dulcamara. You will find that the old ladies, in almost any rural district in which Dulcamara grows, gather it and make it into a salve for ulcers. Well, it is astonishing how soothing it is when applied externally to smarting wounds, whether in solution or salve or any other way. But it is a better medicine, of course, when indicated by symptoms of the constitutional state. It is a better medicine if used internally. It produces ulcers and a tendency to ulceration of the mucous membranes, and this condition will become phagedenic. Sometimes it starts as nothing more than an herpetic eruption, but it spreads and finally yellow pus forms, and then the granulations that should come, do not come, an eating condition appears and the surface does not heal. Especially along the shin bone, there will be raw places, which even extend to the periosteum, to the bone, producing necrosis and caries, so we have affections of the mucous membranes or skin, first becoming vesiculated and then breaking open and eating. It is especially related to very sensitive, bleeding ulcers with false granulations, phagedenic ulcers. This is not generally known. It is a matter of experience with those that have watched this medicine, and again, strange to say, arsenicum, which I have already mentioned once or twice, has this state. Arsenicum leads all other medicines for ulcers that eat phagedenic ulcers. Arsenicum is a typical remedy for spreading sores, for spreading ulcers, and especially those that come from a bow that has been opened and will not heal. Another feature of this medicine is its tendency to throw out eruptions over the body. It is a wonderfully eruptive medicine, producing vesicles, crusts, dry, brown crusts, humid crusts, herpes. Dulcamara produces eruptions so nearly like impetigo that it has been found a useful remedy in that condition, i.e., multiple little boil-like eruptions. It produces little boils, and the boils spread. Enlargement and hardness of the glands. Eruptions upon the scalp that look so much like crusta iacta that Dulcamara has been found a very useful medicine. Extreme soreness, itching, and the itching is not relieved by scratching, and the scratching goes on until bleeding and rawness take place. Eruptions that come out upon the face, upon the forehead, all over the nose, but especially on the cheeks, which become completely covered with these crusts. Eczema of infants. Children only a few weeks old break out with these scalp eruptions, and Dulcamara is one of the medicines that you will need to know. It is about as frequently indicated as any of the medicines. Sepia, arsenicum, graphites, Dulcamara, petroleum, sulfur and calcarea are about equally indicated, but of these, in this climate at least, I think sepia is probably more frequently indicated. All of these catarrhal symptoms, the rheumatic symptoms, the eruptions upon the skin, are subject to the peculiar aggravations of the constitutional state. No matter what the symptoms are, the constitutional state is worse in cold, damp weather. Catarrhal and rheumatic headaches in cold, damp weather. When the headache is the main trouble, the catarrh takes a different course from what it does when the catarrh is the principal ailment. There are two ways in which that conducts itself. In some Dulcamara patients, whenever he takes cold from the cold, damp weather, he commences to sneeze, and to get a coryza, and soon comes a copious, thick, yellow flow from the nose. On the other hand, Dulcamara has a dry catarrh in its first stage, and a fluid catarrh only in the second stage. One who is subject to Dulcamara headaches has the dry catarrh. Whenever he takes cold instead of the usual catarrhal flow with it, he at first sneezes and then feels a dryness in the air passages, a slacking up of the usual discharge, which would give him relief, and then he knows that he must look out, for along will come the neuralgic pains in the occiput, and finally over the whole head. Congestive headaches, with neuralgic pains and dry nose. Every spell of cold, damp weather will bring on that headache. The catarrh is not always acute enough for him to pay attention to it. He does not say very much about it. The Dulcamara headache is very severe, is accompanied by tremendous pains, and he may go to the doctor with the idea of getting rid of the headache, but it is a catarrhal state that is suppressed, that has slackened up, and the nose becomes dry. As soon as the flow starts up, his headache is relieved. Then headache of this catarrhal kind that comes on from every cold, damp spell, or from getting overheated, from getting into a cold draft after being overheated, or getting overheated with too much clothing, and then throwing the coat off, will also belong to the Dulcamara state. A form of eruption that is very likely to be a Dulcamara eruption is the ringworm, herpes cercinatus. It comes sometimes upon the face and scalp. Children sometimes have ringworms in the hair. Dulcamara will nearly always cure these ringworms in the hair. The Dulcamara child is very susceptible to earache. Coryza dry, relieved by motion, worse during rest, and renewed by the slightest exposure, and worse in cold air. Some coryzas cannot tolerate the warm room, and others want a warm room. The Dulcamara coryza is worse going out in the open air and better from motion. The nux vomica coryza is better in the open air. The patient feels much aching distress in the nose. The nux vomica patient ordinarily wants warmth and warm air and a warm room, but with the coryza he is the very opposite. He wants motion in the open air, he looks for cool air, for it relieves the distressing sensation. In the warm room there is a tickling sensation in the nose, and the nose will drip, night and day. The nux vomica coryza is worse in the house, and worse in the night, and worse in the warm bed, so that the discharge will run all over the pillow. In Dulcamara it is more fluent in the house, in the warmth, and less fluent in the cold air in a cold room. With the Dulcamara coryza, if the patient should go into a cold room, pain will commence in the nasal bones and he will begin to sneeze, and water will be discharged from the nose. That very state would relieve a nux vomica patient. Ileum kippa is made worse in a warm room, like nux vomica, is better in cold, open air. Commences to sneeze as soon as he gets into a warm room. So that we see the meaning of such things, the necessity of going into particulars and examining every case. Here is a state that you will often find in the fall of the year, somewhere about August 20th. They sometimes call it hay fever. Every year as the nights become cold, and there is cold, damp weather and fall rains, he has a stuffing up of the nose with constant sneezing and wants the nose kept warm. I have known these cases at times to sit in a warm room with cloths, wrung out of hot water, over the face and nose to relieve the distress, the catarrhal state of the eyes and the stuffing up of the nose. Heat relieves the stuffing up of the nose. These patients can sometimes breathe with these hot cloths over the nose, but if they go out into the night air, or a cold place, and especially if there is a damp, fall rain, they suffer much. Other cases of hay fever suffer during the day, and they go to as cold a place as they can find, and are even driven to the mountains for a cool place. These things are indicative of a state of the constitution, The state gives out signs and symptoms to lead the intelligent physician to cure. If that state had no means of making itself known by signs and symptoms, there could be no curing it by remedies. Profuse discharge of water from the nose and eyes, worse in the open air, better in a closed room, on awakening in the morning, etc. The Dulcamara patient is so sensitive to newly mown grass and drying weeds, that he is obliged to absent himself from the country where they are found. For hay fever we have especially to look up such remedies as have complaints worse in the fall of the year. There are other conditions that are just as much hay fever, for instance, rose cold that comes on in June. There are other conditions that come on in the spring, sometimes cured by nausea and lachesis. So that we have to observe the time of the year, the time of the day, night or day aggravations, the wet and the dry remedies, the hot and the cold remedies. We have to study the remedy by circumstances. The Dulcamara patient often becomes a sickly patient, with threatening of the catarrhal discharges to center in the bronchial tubes, i.e., in the mucous membrane of the breathing apparatus. Many adults die of acute phthisis that might have been cured by Dulcamara, and you will find very commonly among this class of patients those that are worse from every cold, damp spell of weather. Such enter right into the Dulcamara sphere. They are better by going south where there is a continuously warm climate. The Dulcamara patient is a sickly patient, threatened with acute phthisis, pallid face, sickly, yellow and sallow. This shows that it goes deeply into the life, creating such disorders as are found in very sick patients, i.e., those chronically sick, in persons whose vital economy is so much disordered that it cannot keep the body in repair. The throat comes in for its share of trouble. Persons who in every cold damp spell have a sore throat, from getting overheated, throwing off the wraps, getting into a cold place. The Dulcamara patient says, "Well now, I know I am fixed, I am now chilled, I begin to feel hoarseness in my throat." On comes the sore throat, it fills with mucus, with yellow slime, the tonsils become inflamed, even quinsy comes on. Or it may affect the throat uniformly, it may become red and inflamed and dry at times, and at other times filled with mucus, and at night the throat fills with thick, yellow, tough mucus, which is hawked up in great quantities. These colds that settle first in the nose and throat, post-nasal catarrh, of the very worst sort, gradually creep on until the whole respiratory apparatus is in a state of catarrhal inflammation. Every cold that he takes aggravates his catarrh wherever that may be. If it be in the nose, then the nose is aggravated, if in the chest, then those parts are aggravated. A continual rousing up. Every experienced physician must have met with many cases where for a time he felt unable to cope with the case because of his inability to reach the constitutional state that underlies this continual taking cold. So he puzzles, for a long time, and prescribes on the immediate attack and palliates it. For instance, the immediate attack might look like belladonna or bryonia, ferrum phos, or arsenicum, etc. He treats that attack without taking into consideration the underlying constitutional state of the patient. It is quite a profitable business for one who has not much conscience and not much intelligence. But a conscientious physician feels worried and knows he is not doing what he ought to do by his patient, unless he reaches out for the remedy which touches the constitution. It is far more useful to keep people from taking colds than to cure colds. There is a form of acute Bright's disease that Dulcamara cures. You can probably now surmise from what we have said of the nature of the remedy, that in cases of Bright's disease following scarlet fever, or from malaria, or in any acute disease that has ended badly, i.e., the patient has been exposed to the cold too soon, and has taken cold, or from sudden change of weather, damp and cold, the feet commences to swell. There is albumin in the urine, the limbs are waxy, the face becomes waxy and sallow, and there is constant urging to urinate. Dulcamara, with other constitutional symptoms, will be suitable. In bladder catarrh, where there is a copious discharge of mucus, or mucopus in the urine, when the urine stands, a thick, purulent sediment, yellowish white, and a constant urging to urinate. Every time he takes a little cold, the urine becomes bloody, the frequency of urination is increased, the urine becomes irritating, the catarrh of the bladder rouses up like a flame. All the symptoms are worse in cold, damp weather, and from getting chilled, better from becoming warm. So you see, whether it is a catarrh of the kidney or a catarrhal state of the bladder, or an attack of dysentery, or an attack of sudden diarrhea, every cold spell of the weather brings on an increase of the trouble. There is another Dulcamara symptom which will often be expressed suddenly in the midst of a lot of other symptoms. After you have been hunting for a long time, the patient will say, "Doctor, if I get chilled, I must hurry to urinate. If I get into a cold place, I have to go to stool, or to urinate." So we see that the symptoms come on when the patient is cold, and are better when he is warm. Any catarrhal trouble of the bladder that is better in the summer and worse in the winter. In dry, teasing coughs that are winter colds, that go away in the summer and return in the winter. Serenum has a dry, teasing, winter cough. Arsenicum has a winter cough. Rash comes out upon the face before the menses. As a forerunner of catamania, with extraordinary sexual excitement, herpetic eruptions. Its cold sores are very troublesome. The patients are subject to these cold sores upon the lips and upon the genitals. Every time he takes cold, herpes labialis, herpes preputialis. Catarrhal ailments in cold, damp weather. Mammy engorged, hard, sore and painful. Mammary glands swollen, inactive, painless, itching, in consequence of a cold which seems to have settled in them. Cough, from damp, cold atmosphere, or from getting wet. Cough, dry, hoarse and rough, or loose, with copious expectoration of mucus and dull hearing. Catarrhal fever. The cough is worse lying and in a warm room and better in the open air. Rheumatic lameness and stiffness in the back from taking cold, better by motion. Drawing pain in the lumbar region extending to the lower limbs during rest. Stiff neck from every exposure to cold. Stitching, tearing, rheumatic pains in limbs after exposure to cold, better by motion, worse at night or in the evening, with some fever. Sore, bruised feeling all over the body. Warts on hands, fingers and face. Thanks for watching this video. For more updates, please subscribe this channel and press the bell icon. To learn homeopathy course online free with Homeopathy Materia medica. Comment what you want in next video. Like and share this video with your friends and family. Thank you. Have a nice day. Stay healthy, stay happy.